What's up, everybody? Have you been told that you grind your teeth at night? Do you notice clicking or popping in your jaw? Have you ever felt like your jaw is locking up, or maybe you wake up and your teeth are clenched really tight? If you answered yes to any of these questions, you might have temporomandibular dysfunction, otherwise known as TMD. I'm Dr. Jake Shockey. I'm a chiropractor, and you probably already know if you're guilty of this or have these symptoms, but let me explain a little bit more about TMD and what you can do and what I can do to treat this condition. First, let's talk about what the temporomandibular joint actually is, or the TMJ. The TMJ is a hinge joint made up of a few different things. First, we have our mandible and our skull. So zoomed in over here, you can see the mandible and the condylar head of your mandible inserts into the temporal bone of your skull. Next, we have some of our soft tissue structures, such as this cartilaginous disc and some of our muscles, tendons that help to open and close the mouth. Finally, the last piece of the TMJ is going to be our teeth. The TMJ is vitally important in things like eating, speaking, and breathing. Now let's talk about one piece of the TMJ that's going to be responsible for quite a bit of this pain. This disc here is there to cushion your jaw whenever it's opening and closing. When there's dysfunction in this, the backside of this disc is going to be called our retrodiscal tissue, is highly innervated, meaning it has a big nerve supply. So dysfunction in the jaw, big nerve supply in the disc is going to sense dysfunction, and it's going to send pain signals to the brain. And because it's so highly innervated, there's going to be a lot of pain signals to the brain. So now that we've talked about what TMD or TMJ is, how do we know if we have it? First, if you think you have it, like we talked about, you're going to hear clicking and popping in your jaw. You're going to be able to look in the mirror and see when you open and close your mouth that it shifts to one side or the other. You're going to have a dull, kind of achy feeling in your sinuses that might radiate into your jaw or even down into your neck. As a chiropractor, or you may even be able to ask somebody nearby, you're going to be able to see with posture, head jutting forward is going to be a contributor. So as a chiropractor, what do? We love to use our hands. That's how we get our answers. So we're going to palpate. We're going to look for swelling, any trigger points in the neck muscles or surrounding facial muscles, hypermobility in the TMJ. We're going to check your bite to make sure that it's straight, on line, and we're going to look for quality of movement with opening and shifting of the jaw side to side. So like I alluded to earlier, if you look in the mirror, you watch yourself open and close your mouth, you should see symmetrical movement from side to side and a straight up and down movement with your jaw. As we talked about earlier, the TMJ is a hinge joint. That means it's going to move in the sagittal plane. It's not meant to open and then shift down to the side. So those are some easy ways that you can look for possibly TMJ or TMD in your scenario. Some common trigger points that we as chiropractors see are going to be in the temporalis, masseter, and pterygoid muscles, and the facial and kind of head muscles, basically the ones that are in charge of opening, closing the jaw. So for treatment, what are we going to do for it? Most TMD cases respond very well to conservative care. Usually anywhere from 3 to 6 weeks, we can get a patient feeling much better and improve the function of the opening and closing of the jaw than when they initially present. Soft tissue release, some PIR stretching, so post-isometric relaxation. We could challenge the jaw in a certain direction, hold it there, and then relax, try and get it a little bit further. Basically, the end-all be-all goal is going to be to restore movement, alignment of the jaw, and restore overall function of the jaw and facial muscles. So with that, not only are we looking at the TMJ and the jaw, but we're going to look at the cervical spine, the head, and the CT junction and shoulders. So all of these areas can be contributing factors into what's considered TMD or pain in the TMJ. So oftentimes in these areas, we find restrictions or blockages in the spine. We're gonna see range of motion limitations, or maybe even pain with range of motion. We're gonna see increased tone and tension in the muscles surrounding the jaw, the head, the neck, even into the shoulders. And we're gonna see some sensory changes. So there might even be some numbness, tingling, facial sensations. We're gonna also probably co-manage this case with a dentist or some type of facial specialist that can prescribe or create an individualized night guard to decrease the inflammation and alleviate those symptoms, allowing that joint to kind of calm down and to heal. This is going to reduce long-term degeneration of the TMJ, this retrodiscal tissue, and the disc and the teeth. At home, what can you do for this? First and foremost, you can correct your posture. Postural changes are going to go a long way for how the jaw operates. Next, you can incorporate an inflammatory or a non-inflammatory diet. You definitely don't want to inflame yourself here. So what you're going to be doing is looking at foods in your diet, foods or drink, that are going to be non-inflammatory. The last thing you want to do in this case is inflame your tissues, inflame your joints, because what is that going to do? It's going to create more pain and more sensation that tells the brain something hurts. So non-inflammatory diet, let everything calm down. And then finally, you can work on stress management. So find some things that you might like to do: exercise, yoga, meditation, reading, all of those things. There might even be other ones that you enjoy, music, who knows. But the end goal is going to be to manage the stress, eliminate some of that biting, clenching, holding tension in the jaw and the muscles around it. And then in office, individualized, we might prescribe some post-isometric relaxation that you can do on your own at home based on where you have the pain, which movements you're restricted in. And of course, the PIR stretches that we would give would be individualized for you and may not work for everyone. So if you think that you have checked the boxes for a lot of these symptoms or can relate to this, maybe you know somebody that's going through some jaw pain or describes a lot of these same symptoms. Maybe your partner, you notice clenching or grinding their teeth at night, or complains of headaches or jaw pain when they eat. Send them in, let's take a look, let's sit down, let's figure out exactly what's going on, and then we'll come up with an individualized treatment plan that works just for you to help get you back to where you can sleep through the night, get good sleep, eat with no pain, and you can go about your ordinary life without having to worry about any TMD or TMJ type pain. Thanks. We'll see you next time.